They're used to having professional people around them. So just involving the men more, just making sure, you call them from behind the door frame, saying, what do you think about this? Gosh, I like the way you, or how about this, or I don't know how I do it, but involving them.
Yeah, because I've been working with a group that really believed in a notion of inclusion.
Yeah.
And it feels very similar to what you mean by involving, fathers within the relationships. Yeah.
For really complex reasons. Complex, I don't know where to start really. I mean, this is social inclusion quite often, because these are men, often these were men who are at home during the day for various reasons, maybe ducking some systems, not wanting to be seen really. And sometimes the things that cause them to be in that position would mean that they may not be very good at relationships at home either. I made a giant leap in that statement, but and so sometimes their partners would complain about them or wish they were different as well. And so just involving them in just treating them as being really important in the process. You might be surprised to hear that health visiting hasn't done that before, but I don't think we've been very good at it. It's been very easy just to not to take notice of the partners. I think across the board now people are trying a lot harder, but I'm actually quite proud of that project where I was most interested. I like a challenge, you see, and I was most interested in making relationships and engaging people who are most unlikely to be engaged. It was like a sort of little challenge to me to try and get the people who wouldn't go anywhere else to come to that project. And to a certain extent, managed it.
Yeah.
Yes.
Yeah. And that would be lovely to connect in with the writing and creativity works. Because I think that just the brief video of you expressing your values now, it will bring, I believe, literally other people in. It will attract others to understand the values that are motivating you, and especially those relational ones, and then this idea of, what is it that constitutes a worthwhile conversation? And I suppose I'm really curious about something that's coming to the fore now in quite a lot of education research communities, about what is called the complex ecologies. So the idea that we are very influenced by the kind of culture within which we are living. And that move of yours to involve the partners, recognising how important the partners are in the influences within the family. So there's that sense of being family-led. And I'm just curious about whether you've also a sense of engagement or involvement with what are now becoming known in terms of the ecological or the cultural influences. Does that make sense as a question?
Yes. Don't know where to start with that. Whether you're meaning being sensitive to the different cultures there, or whether you're meaning what influence we're having on the culture. Both, really, I suppose.
You've made my question more significant by making that distinction. So I think that's really important to answer the kind of both. Yeah.
I was really interested recently working with a family from another country who, where the parents had great difficulty accepting and some of the services available for their child, a child with particular needs. And I think it was the interpreter who pointed out that this family in their own country would not have had services like that. They would really at home have expected just to put up with this child's difficulties until it got to school, and then the school would deal with it. And so for us to be putting in all these preventive measures and services in order to prepare ready for school, it's putting an extra burden on them, when actually the other thing is they have a particularly strong work ethic, so they both want to be out there working, which is of course really different from a lot of the English culture that I meet, who don't have such a strong work. So it's that different thing about just being aware that preparing a child for school and helping a child to develop its abilities in preparation for education was a low priority, but actually being out there working and earning money and taking responsibility for yourself because there aren't benefits at home was a really high priority. So no time for appointments or to go and see the child. It was kind of interesting.
Yeah.
I hadn't met that before.
Yeah. Well, and what about the other one where, because you brought in, I think that's really important, that becoming aware of, the influence of different cultural backgrounds. Well, then, and there's also an awareness that I think you have because of your early work, where I know you actually participated in kind of that anti-smacking campaign, and you took this national. So I know you're aware of the importance of these wider cultural influences, and I'm just curious about whether your focus, in terms of the health visiting, like as it's being family led, I can see almost all your time can be spent supporting those families or working with them. To assist. As I said, I also know you in other contexts are very aware of the cultural influences, and I'm just asking, are those part of what you do?
Really good question. I'm really glad you asked that one. Yes, because I came into this process, this living process of finding out about myself and what was important to me, because I noticed smacking at a time when smacking was not questioned by anybody. It wasn't questioned by professionals. It was a really common, accepted but untalked about method of disciplining children. And that's now, is that 20 years ago? Could it be 20 years ago? Do you know it is? 1989, I suddenly noticed a mother who put her child on the scales and raised her hand in threat to get the child to sit still so I could weigh, so it wouldn't wobble. And I was just so shocked by this. And that was the beginning. It was one, and another one also. And those sort of things had probably always been there, but I suddenly noticed them, and I kind of realised at the time. Sorry, that I've gone back, as you say. I kind of realised at the time that this was deeply ingrained in our culture, these threats, and that mother who was threatening her child had domestic violence herself. I'd seen her a bit in her angst because of the domestic violence, and that this was actually fostering yet another generation of violence in the home. And so that's where I was coming from. I saw that, and then I began all that campaigning and raising awareness, and it was tremendously successful. It grew and grew. And now I don't need to be campaigning anymore because it's a national-wide process, although Britain is still way behind in having the law changed, which is kind of interesting. The Western countries were one of the few that haven't changed the law to say that hitting your child is not right. So as health visitors, we're not supported by the law. It'd be easy if I could go and say, well, how can I help you to stay within the law? Well, I can't do that. So I went off and learned about Adlerian theory, as you know, which is just really useful because I can take it now from a different approach.